Hey guys, it's Antonio, and for Halloween this year, I was a firefighter. Now, you might be like, Antonio, I thought you were an EMT. Yes, I am an EMT. But, fun fact, what you probably don't know is that most firefighters are EMTs. Another fun fact that gets even more interesting is that around 70% of firefighters' calls aren't actually related to fires themselves. Around 70% of their calls are medical calls that they respond to as EMTs. And also, when you're working as an EMT, you're not necessarily just doing 911 calls on the back of the ambulance. There's actually a couple of other options you could be doing in emergency medical services as an EMT. In this video, I'm going to cover the big 5 types of jobs that you could get as an emergency medical technician. You may be wondering, what are the big 5? The big 5. The most common: 911 EMT, IFT or interfacility transport EMT, event EMT, Firefighter EMT, and hospital-bound EMT. Those are the big 5. The place that I work at, the thing I do like about it is that I have access to 3 of these different types of shifts. So I can work as a 911, IFT, or event EMT, literally basically at my choosing, which I do like. I think that's very cool. Me personally, so far, I feel like I've learned most as a 911 EMT, so I've been working a lot of 911 EMT shifts lately. But let's get right into the video, and I'll explain the differences in a job and the lifestyle difference between these types of EMTs. Starting out with the most popular, what you think of when you hear EMT is a 911 EMT. As a 911 EMT, you're out there in the field on ambulance. You're usually going lights and sirens to the calls, and you're going to be responding to people's emergencies that they called 911 for. I guess that's in the name. But yeah, it's basically your general idea of an EMT. You're driving in an ambulance, you're going lights and sirens to calls, going to businesses or people's houses or wherever a patient's at. You're going to care for the patient, check them out on the scene in the back of the truck. If they want to go to the hospital, you're going to end up taking them to the hospital. Depends on where you live at and how busy your service is, but after you drop them off the hospital, you might end up going back to your station and being able to rest up, or you'll be going right back into the field, responding to another 911 call, which I've had some shifts where I've taken 11 calls. I've responded to 11 911 calls in 12 hours, so keep that in mind. I know some of my friends that have responded to, but there's also been shifts where I've only responded to 2 911 calls in 12 hours, you know what I mean? So it really varies on where you live, what's going on for the day, but it could be a very busy shift, it can be a very busy job, or it could be a relatively chill job. Out of the big 5, this one and firefighting EMTs probably have the most stressful situations that you're put into. But they are probably also, in my opinion, probably the most rewarding, the most rewarding positions, in my opinion. Alright, next we have IFT, or interfacility transport EMTs. IFT is basically where you're going to take a patient from a hospital to a different hospital. You're going to take them from hospital to their house, hospital to a nursing home. But it's basically where the patient is in a stable enough condition to be able to be transported or moved. Usually the patient, if they're going by ambulance, the patient is probably not ambulatory, like they can't use their legs, they might be missing a leg, they might have a broken lower extremity, they might have weakness, but at the end of the day, they need transport to a different facility, and they need the ambulance to get there, but they're in a stable enough condition to be able to be moved, so that's your job as an IFT. You're going to check in with your nurse at the hospital, you're going to gather their belongings, you're going to put it on the stretcher, put it into the ambulance, you are going to get the report from the nurse, why they were there, where they're going, what you need to tell the new facility, and then you're going to take them to that facility, you're going to take their vitals en route, and if for some reason they need treatment along the way, you can treat them you can help them out to what's in your scope of practice. Most commonly, they might be on oxygen, so you might have to have a portable oxygen tank, taking them from the hospital to the ambulance, and then in the ambulance hooking them up to the truck's oxygen, and then when they get to their new facility, hook them back up to the oxygen. You get to their facility, you're going to give them a report, you're going to get them moved over to their new bed, you're going to give them their belongings, and that's about it. You'll usually do a decent amount of calls in a day. Where I work at, when I do IFT, vary from 3 to 6 calls in a 12-hour shift usually. It's a little bit more laid back. You don't have to immediately respond. You're not going to be going lights and sirens to the calls. It's going to be driving. Like if you see an ambulance that's driving by, It might be an IFT ambulance with no lights and sirens. It might be an IFT ambulance, you know. Yeah, you're not going lights and sirens, nothing too fancy. You usually have a lot more waiting around in between calls, and yeah, it's a pretty good. If you have no experience at all and you're a little bit nervous about doing 911, I'd recommend doing IFT. You can learn. You can still learn a lot. And it's a good way it's like a good stepping stone to get your foot in the door if you're a little nervous about 911. I did a couple IFT calls before I did 911, and it kind of took away the anxiety and it made my 911 shifts when I first started go a little bit easier for me. Now, there is number 3 is events or standby EMTs. This one is, in my opinion, the easiest one at the end of the day. When you're an event or standby EMT, you're basically going to be at an event and you're going to be doing what I just said, standing by. You are basically the first responder for that event. Sometimes they won't even put you on an ambulance. You'll just have a jump bag, which has a bunch of like the main medical materials you might need for a call, and you'll just be at the event. And if someone at the event needs help, your job is to go to the patient. The person needs help. If it's something small, like they need some Band-Aids or they just want their blood pressure checked and everything comes back normal, then you could be like, okay, you could be on with your day. You got them you put the Band-Aid on, they're feeling better, or they check their blood pressure, it was normal, they're feeling all right. Then you can just let them know. They can end up moving on with their event, moving on with the day, and you just go walk around the event, check on people if you see anyone looks like they might need some assistance. But at the end of the day, it's pretty chill. You usually get to enjoy the event. A lot of times at events, they end up offering me food or just stuff like that. Usually, I don't have anything that goes on during the event too, which makes my job easier because I'm just at the event, helping out people if they need help and enjoying the event from standby. You know what I mean? I'm still working, but I'll be able to. I chat it out with people at the event and meet new people, so I think it's pretty cool. If it's a situation where, oh snap, this person needs to go to the hospital, what you usually do is you're at the event and you're going to treat them at the event as a first responder. And you're going to call another ambulance unit to come pick up that patient from you. So when the other ambulance unit gets there, you're like, this is the patient, this is what happened, this is your past medical history, this is what I've done so far. You're going to hand it off to the ambulance crew. They're going to take the patient to the hospital. And usually you'll just end up staying on scene and just continuing standby at the event. From my experience, of course, it can vary from agency to agency and where you work at, but yeah, that's the main thing. Sometimes if you're at a sporting event, you'll have doctors or physical therapists on scene with you, so sometimes they'll be like, you know what, we're going to treat them here, we're going to do this. They might have like a nursing station where you'll move them to, and they'll make further decisions on there, whether they're going to get treated there or get taken to the hospital. But yeah, it's pretty relaxed in my opinion. On average, let's say you're working for 12 hours. It depends on what event you're doing. Like I've done events where it's just like, I've done chill events where I've done a lot of chill events where I've had no calls at all, but then I've also done other events that were out in the hot sun and had a decent amount of call for 12 hours. But yeah, you could either get nothing or you could be like IFT busy, maybe like 6 calls in 12 hours, but that's the busiest I've seen it so far. Now next is fire-based EMS, which is what I am. I was for Halloween yesterday and what I'm dressed as today, because I was like, shoot, since I got the firefighter fit, I might as well make a video. But, yeah, fire-based EMS. Most firefighters are EMTs. What they'll often see is that fire stations are more spread out and can get to a scene in an emergency faster than your average ambulance can. So, the fire department themselves will have their own ambulances that they'll just send out to the calls. But the people that are going to those 911 calls are firefighters just in an ambulance. It really depends on what state you're in, what county you're in. It varies from county to county. The county I'm in, all of our firefighters are EMTs, so they'll usually beat us to the scene. They'll start getting their vitals, they'll start getting the background information, and by the time the ambulance gets there, me and the ambulance gets there, they usually have a history of what happened. They've got their first set of vitals, and they might have started some smaller treatments, or they'll just be waiting for us to get there, hand off the patient to us, and start the treatment. In that case, they're the first responders, where they are just they get to the scene first, and they help out the patient as much as they can before the ambulance gets there. And then when the ambulance gets there, they pass the patient along to the ambulance, and the ambulance takes them to the hospital. or if you're in a fire-based service where you have your own ambulances, you are going to respond to the call as a firefighter in the ambulance. And when you get to the call, if they need to go to the hospital, you are going to take them to the hospital as a firefighter. So yeah, when I'm at the hospital, oftentimes I'll see certain counties with their firefighter ambulances at the hospital, which I think is pretty cool, not gonna lie. Like, a lot of firefighters, they get into firefighting to fight fires, but I would be a firefighter mainly for the medical calls. Like, I'd rather run medical calls than firefighting calls, but I'd do both. But yeah, that's just me if I was a firefighter. Don't think that's for me in this lifetime, but it does seem like a very rewarding job at the end of the day. You know, you get the best of both worlds. You get the adrenaline of fighting fires and the adrenaline of going to medical emergencies. You're winning. And you get to relax and sleep at the station. Then the last of the big five is the one that I have the least experience with, but I've heard about, which is basically a hospital-bound EMT, where you're not on an ambulance, you're not running lights and sirens to calls, you're not at an event, but you're actually in the hospital. And what you do as a hospital EMT, most of the time, is you'll work in, like, usually it's an emergency room, and when you're in the emergency room, you're there to help take vitals. Usually, you're not going to be giving out any medications in the scope of practice, but you might hook up a patient to oxygen, you might help move a patient around the hospital, you're going to take some vitals, give reports, stuff like that. I've never worked this position. I don't know any normal EMTs that have worked this position. I know paramedics that have worked as a hospital EMT. The paramedics, they do a lot more. The paramedics in the hospital, they might be doing intubations, they might be doing other more advanced procedures, but as a normal EMT basic in the hospital, your main thing is going to be collecting vitals and moving around patients. Overall, those are the big five of EMS jobs. Of course, there's some other types of EMS jobs that I just don't know enough about to even add to this video, and they're also much less common than the ones I just told you about, but those ones do include tactical EMS or SWAT medic, search and rescue EMTs, industrial or occupational EMTs, and community paramedicine. Those are a couple different other types of EMT jobs I just don't know enough about yet to actually talk about in this video. I'll talk to you about the ones I'm most knowledgeable about, and that are most common. But yeah, I hope you guys did enjoy. I hope you learned something, and next time you see a firefighter, know they are fighting fires, but if you ask them how many fires they fought in the past week, I can almost guarantee you they've ran significantly more medical calls than they have fought fires in the past week, because that is a big portion of their job that most people do not know. Shout out firefighters. They do a lot for your community. They do even more for your community than you actually realize. At the end of the day, you think you're just there to fight fires, but they're also there for when Grandma falls down and she needs help getting up. They're there for Grandpa when he has a cardiac arrest. They're there for cats stuck in trees, you know what I mean? So, yeah, those are different types of EMS jobs. Hope you enjoyed. To the next one.